Well, it's wonderful to be back together again, isn't it?
Yes.
It is.
It's like the beginning of the new year, whereas school starts, we get like two New Year starts, right? One at the beginning of the year and then one in September. Gets us all in the jig of getting back to education and getting back to all the rules and routines.
Mm.
Absolutely. It is nice to have that fresh start. I'm not going to lie. I did go to the store and bought myself some new pens because, in September, it's back to school. You got to pick up some new pens so then I can, make my notes, make my to-do list, because I am a bit old fashioned that way. I like to see it done and then cross it off or, have it look pretty. And then if it looks pretty, I'm more likely to do it, I think. I don't know if that really is the case, but definitely bought myself some new pens.
Smart.
Oh, we've got lots of people joining us right now, which is awesome. And we're streaming on Facebook Live, which is wonderful. So we got lots of people watching this now or later.
Where are you today, Carrie?
Today, actually, I was working with Aura Vital this morning out here in Niagara-on-the-Lake, and Henry Schein headquarters offered me a room so I can actually join live. So this has worked out really well. So I thank you very much, Henry Schein, for allowing me to utilize your space and your Wi-Fi to come to you guys today.
That's key, right?
Wi-Fi, good Wi-Fi. That's the whole key. And if I freeze, hopefully it's not like a really crazy face. Okay. And Kathleen, it looks like you are visiting us from RDHU. Is that true? Is that where you are today?
I'm actually in my office at RDHU in Burlington. Yeah, it's good to be here.
Yes, I can see your product design, your stuff in the background there.
Yeah, our displays. Yeah. It's a lovely office.
It really is. Yeah. All right. Well, I think we're kind of right here at 12 o'clock. So we're going to get started. I'm excited to be here. I know we're all excited to be here and back with the RDH View. Just a few kind of housekeeping comments right off the bat, and then I'm going to hand it over to Kathleen. So you will notice on the bottom of your screen or the side of your screen, however you're set up, you'll notice a QA function as well as a chat function. So we are going to do our very, very best to get to every question and comment that comes in, and we welcome them. We hope that you do interact with us. If we don't get to your question or comment, just please know we're not ignoring you. We're just, there's a lot of people here excited to kind of, to be just together as this community. So we will do our very, very best. If I could ask you a favor, the easiest thing for us is if you use Q&A for your questions. It's just a little easier for us to kind of organize. And then if we don't get to your question right then, at the end, I can kind of go back and see which questions haven't been answered. If you have just a comment, you want to just say hi, then you can use the chat function for that. Okay. And this is going to be recorded. So if you have young ones with you, or if you've got a client who's waiting for you and you have to leave at any point, this will be recorded and available for you later as well. That is all from me. I'm going to hand it over to you, Kathleen.
Thank you. Yes, anyone who has registered will get the link to the recording and also to the CE certificate. So you should receive that link, I would say, by the end of the day, and then you'll have access. Okay. All right. So all the way here from RDHU, I'm very, very pleased to introduce you to Ondina Love from the CDHA. So Ondina has worked in association management for over 36 years, the past 25 years in healthcare associations. She is currently the CEO of the Canadian Dental Hygienists Association, and that's the 6th largest regulated health profession in Canada. She also serves as Executive Director of the Canadian Foundation for Dental Hygiene Research and Education. Ondina also serves as chair of the Extended Healthcare Professionals Coalition on the steering committee for the Network for Canadian Oral Health Research. And she recently served as co-chair of the HEAL, which is the Organizations for Health Action, a coalition of 41 national health organizations dedicated to improving the health of Canadians. Prior to that, Ondina was the executive director of the Canadian Association of Speech Language Pathologists and Audiologists for 10 years. She also held various positions with the Canadian Nurses Association from 1996 to 2000 and served as executive director of the Canadian Nurses Foundation. Prior to working in healthcare, she worked for 11 years with 2 national sports associations as executive director of the Canadian Rhythmic Sportive Gymnastic Federation and marketing director of the Squash Canada. And speaking of sports, Ondina, didn't you receive your black belt in Taekwondo a few years ago?
Yes, I did.
That's impressive. Well, this is such an impressive and esteemed bio, Ondina. So thank you so much for being here with us today. We are so thrilled to have you. And I guess I'd like to start off this conversation just by talking about the new federal dental care plan that the government has announced. So I was wondering if you could tell us a little bit more about that program.
Sure. Thanks so much, Kathleen, and thanks to all of you. It's a pleasure to join you today. I'm actually, one of the things we're very excited about was when the NDP and the Liberals kind of made the announcement that there would be a federal dental care plan. So we're very, very excited about this opportunity. And we've been working very, very hard with our government counterparts to get the message for dental hygienists out there in terms of what we want. So right now, the government was supposed to make an announcement on the details of that program yesterday. However, unfortunately, the Queen passed away yesterday. And so that announcement, from what we've heard, will be next week. But there's a few details that have been leaked, which I will share with you in a minute. But I just want to talk to you a little bit about CDHA's kind of vision for a federal dental care plan. Right now, we really support federal administration and delivery of the new program. And I'm just going to, if you see me look into the slide, I'm checking some of my notes that I have to make sure I get accurate information to you. But the program right now for this year, they made a commitment by the end of 2022 that the program would be for children under 12 and under would have access to dental care plans for families with income less than $90,000. And also the important point is, it's for people who don't have access now. If you're already covered through through employer-sponsored plans, you are not eligible. If you're already covered through any other funded dental care plans, you're not covered. It's looking for that gap. And I think that's an important distinction because some people think, oh, they'll drop their federal, their employer plan and just go through the government plan. That's not the intention of this program, and that's not the way it was funded. It's for filling the gap, providing access to oral health care for those who don't have it, our most vulnerable Canadians. And that's really an important distinction. We really feel that if we just threw money at the provinces and gave all the provinces more money, it's not a great solution because, as we all know, the access to oral health care varies significantly from province to province. And in fact, for dental hygienists are not reimbursed in a lot of provincial programs directly, only if they work under a dentist. And so for our independent dental hygienists, oftentimes in some provinces, they can't be reimbursed for providing services. And we all know that dental hygienists are the ones Canadians. They're the ones going to rural and remote communities. They're the ones going to long-term care homes, working with seniors. They're the ones going to daycares and doing fluoride varnishes and preventative treatments. I mean, the dental hygienists are the ones that are going to actually make this program successful. Prevention is key. And fortunately, all the government departments we've met with really agree that prevention is a key focus. So we're really pushing for a kind of federal plan that reimburses dental hygienists and includes, preventative services and can reimburse dental hygienists directly. So that's kind of been our ask with government. We have met with the Minister of Health. We've met with various staffers at with Health Canada. We've also met with Minister Qualtroux's office. We've met with numerous members of Parliament and members of the Health Committee to try and get our message across. Because we are, as was mentioned in the bio, this Canadian dental hygienist is the 6th largest regulated health profession in the country. So there's over 30,000 dental hygienists in Canada. And, it's really important, the role of prevention and the role of dental hygienists in this plan. And also, I know we'll be talking about workforce later, but to be successful, we can't just have a treatment-based plan. Treating disease after it happens is not going to solve the issue. We need to prevent disease before it happens. So that's kind of like a really important part of our messaging to any government officials that we meet with. So in terms of the plan, what was leaked yesterday. So the leaked plan, allegedly, so again, this will be confirmed next week when it's launched, that those families who earn $70,000 or less, they're going to provide annual checks of $650 per child, because the first year is just for kids under 12. The second year will be kids up to 18 and seniors and persons with disabilities. So that's the second year of the plan, but this year is just children under 12. And again, it's for those that don't already have coverage in other things. So it's for those who earn $70,000 or less with annual checks of $650 per child, $390 for families with incomes between $70,000 and $80,000, and $260 for those earning between $80,000 and $90,000. Now, caveat there, the NDP have been really pushing that all families under $90,000 get the full credit of $650. So that's why we're waiting for the details to be released next week. And we really don't know, the devil's in the details. That's why it's really important that we have a group of dental hygienists from across the country and all the provinces who have been providing expert advice to us on this. They're the ones that work with provincial programs. They work with federal programs like the Non-Insured Health Benefits Program or Veterans Affairs or Blue Cross, all those federal programs. And so they've really been helping us in terms of what are the recommended list of services that should be provided, and ensuring that dental hygienists can be reimbursed under whatever plan is provided to really have access to the workforce. So we don't know the details, and we'll be prepared to respond when that's announced, hopefully next week. So that's kind of like a high level overview. And if you have questions, I'm happy to answer them, because it's a very exciting opportunity. We really want this program to be successful. You know, to have the federal government actually investing in dental care is fantastic. You know, recognizing the importance of oral health to overall health is phenomenal. But we just have to get it right. That's what we're trying to do now.
Wow, that sounds like that is going to be an exciting implementation, and hopefully it will get to its goal where it's filling that gap of what we're seeing out there. So with that kind of in mind, I know that CDHA has had a really great focus on seniors, and I know that you've, you know, we had a whole senior supplement this year that was a really great media campaign. So what else can we look forward to? What is the guiding light in dealing with seniors? And how are we going to see access improve for seniors?
Yeah, that's a great question. Seniors has been a priority for CDHA for that. We've kind of made it a focus for the last couple of years. It's interesting because, as we all know, during this pandemic, the population that was hardest hit was our senior population. And we know the importance of oral health. People don't go into long-term care and take their teeth and put them in the jar anymore. They have their teeth and they enter those systems, and there's little or no care. There's so many issues with seniors. So we had, an expert working group. We commissioned a policy paper on access to care for seniors. And we've made 5 key recommendations, which I'll share with you in a minute. But I want to mention that for seniors, well, I'll talk to you about the recommendations. And well, I want to mention the reason that people think healthcare is provincial mandate, right? So why is CDHA working on this? So the federal government announced that they would be developing national standards for long-term care because they saw what happened as a result of the pandemic. So they announced that they're going to be developing these national standards, which the provinces would then have to adhere to. So we said, we want to make sure that oral health care is included in national standards for long-term care. Like, we should ensure that there are dental hygienists in long-term care homes that can train the PSWs or the support workers and the nursing staff and be there to support them in terms of oral care. To ensure that there is a proper assessment by a registered dental hygienist upon entering a long-term care system, to ensure appropriate referrals for other dental work. We want to ensure all those things happen. And that's why we got involved in terms of making recommendations with the Minister of Seniors, with the Minister of Health, again, regarding the access to care for seniors. So I'll share with you in terms of our key recommendations, and all these documents can be found on CDHA's website. So if you look at the recommendations, did I share the right screen? Okay, good. So the number one recommendation, I'll just kind of make this a bit bigger so that people can see, is that care teams include dental hygienists. Professional staffing and interprofessional collaboration in long-term care homes should incorporate dental hygienists to ensure the comprehensive program of oral health services to meet the assessed oral health needs. And then number 2 is oral health services for long-term care home residents must include oral health assessments, the development of personalized oral health care plans, and the provision of daily mouth care by dental hygienists or people that are trained by dental hygienists. Number 3, oral health, all direct care workers in long-term care should receive education on oral health. And this education should be developed and delivered by dental hygienists. And then number 4 is legislation pertaining to long-term care homes across the country must reflect minimum standards for oral health care and related aspects. And oral health and accreditation standards for long-term care homes, to ensuring that there are accreditation standards that are developed in that regard. So these are some of the 5 key recommendations that we've been working on in terms of long-term care. And in our policy paper has reflected that as well. So it is really critical. We have a number of dental hygienists right now that actually have contracts with long-term care homes and are providing services, really valuable services in those homes. And so we know that, you know, there is a workforce there that is willing and has the skills necessary to provide this care to in long-term care homes. And that's kind of where we're focused. We know that the nursing staff who work in these centers and the PSWs are burnt out. They, you know, it's not for lack of wanting to provide oral care, it's just lack of time, and they're so stretched so thin. We need to have the right health professional in the right place at the right time, which includes dental hygienists.
Do you know, Ondina, if there are in the areas where there are dental hygienists actually working in long-term care facilities that have those contracts, are they tracking like the state of their overall health? Just saying, if they notice a change year over year, that they are providing education and care, and does it elevate the population in that particular community?
Yeah, that's a great question. I've heard a lot of anecdotal information. You know, I've heard a lot of stories of people, once they started getting oral care and long-term care, they could eat, they could swallow, they could chew, they could communicate, all those key factors, which they never did before, you know, and gets people out of pain. And so I haven't seen specific research assessing that. Again, a lot of that care is people paying for it out of pocket. So only those that can afford are doing it. So obviously the people paying for it value it and recognize the importance because they continue to pay for those services. So, but we really feel there's a strong role for government to ensure the oral health care of our seniors.
I'm really excited that we're really starting to get that prevention focus. And as hygienists, that's why we went into the profession. And I feel like it's finally highlighted that, you know what, it's about the prevention. It's not disease medicine. It should be about disease prevention. And I think the pandemic highlighted some of our pitfalls in all areas of medicine. And I feel like too now, whenever I talk to PSWs or nurses, they're open to the information and they just need the resources or the help. So if we can be that ally that's coming in and working alongside them versus telling them there's more to do, we're going to really change the world. And I'm so excited that we are starting with, you know, working with the kids. And if we can educate the kids, you know, under 12, well, if we can get them organized, by the time they're 16 and 18, they're not going to have the same problems if we really get a good focus on prevention. So this has really excited me. I know the chat box has had a few questions. Beth, do you want to ask any of those at this time before we keep going? Because I think some of them were relevant to what we were just talking about.
Yes, that's a great point. And just to echo what you just said, Carrie, I love that you were talking about and acknowledging how busy the PSWs are. And so it's not about us saying like, you need to do better, but I love that you were just talking about that partnership, because how beautiful is that we're coming alongside someone else. We're not telling them that they just are terrible at their job. We're like, let's partner and let's make this better. And I just wanted to say, I loved what you said there. Ondina, there are some questions.
Yeah, I'm seeing the questions. And so, so one question is, so the $650, does that include preventative services or only restorative? Now, we've been very clear in our meetings with government and that it needs to include preventative services, and that dental hygienists need to be part of the program. As I said, we don't know. The details haven't been announced. Hopefully next week, and we will be on top of that for sure. The 90,000, I have no idea. Again, the devil's in the details. We'll wait. The question story is wondering if the 90,000 is gross income or net income. We don't know. I don't know yet. We'll find out next week when there's an announcement. And from what I understand, the question is the amount going directly to the dentist or the checks going to the parent? Just wondering how they know the parents will spend the money at the dentist. And that's a question that I have. Right now, it says the checks are going to the parents. Now, what I've also heard leaked, again, this is not any official information, is that people will be getting a dental card that they could take to the dental hygienist or the dentist to get to have that. But for the first part, I think that's what I'm waiting for those answers as well next week, and then watch CDHA's website for further updates, because I definitely think that's a very, very good question, and that was my question, and that's also CDHA's concern when you say let's give the money to the provinces, because then there's no guarantee that the provinces will spend the money on dental care or oral health care. They're going to spend it on roads or whatever they think is a priority. And that's what happens in terms of the health transfers. We have to make sure that if there is money going to the provinces, that there are accountability agreements in place with the provinces to guarantee that that money is being spent on oral health care. And in that case, we would fully support giving money to the provinces, but only if it's meets the standards that dental hygienists are reimbursed and the money is spent on oral health care to improve the oral health care of the people within their province.
Do you think we're getting any closer to having a dental hygienist in like Emerge or in a hospital, and being able to make those recommendations that stick?
Yeah, we actually we are seeing trends. I think there's never been a more exciting time to be a dental hygienist. Like the opportunities for dental hygienists right now, they can be self-employed, they can have their own business, they can work in long-term care, they can work with children, they can work in public health, they can work in research, they can work in education, they can work in professional practices, and they can work in hospital. A lot of hospitals will actually, they require, oral hygiene appointment to make sure, especially if you're going to be intubated. And there is lots of research to say that if dental hygienists are on staff, that there's good research. Interesting, I'll just share, my mom just had heart surgery a couple weeks ago, and I was with her in Kitchener when the nurse was discharging her, and I was thrilled when she talked about the oral systemic link between heart disease and good oral health care. And part of the discharge was to ensure she had, and she didn't know, I was standing there, but she didn't know who I was or where we worked, but she talked about the importance of oral health to overall health, and you have to ensure you have good oral hygiene. So that was really good in terms of discharging a heart patient. I mean, we have our oral systemic link position papers. I think we're publishing our 5th one very soon. And so those are all available in the Canadian Journal for Dental Hygiene, which is open source now, so anyone can access those articles. So, and also the WHO, the World Health Organization, has recognized the importance of prevention and oral health for the first time ever. And so, we're engaged in those discussions, and the International Federation of Dental Hygiene is engaged in discussions with the WHO as well. So it's a very exciting time, I think, for dental hygiene and the important role of prevention that Carrie, that you mentioned. It's very exciting times.
Well, you've just excited another passion of mine, which is that oral systemic component. And I really feel like right now as a hygienist, the job market is different. The job is a bit different from all of the PPE and all of those things. And I truly feel like if you're not happy where you are, there are opportunities out there, and you can change career paths, you can change different opportunities, you can change dental office locations. Can you give us a little bit of insight on what CDHA knows about the job market or opportunities? Because I feel like right now, a lot of hygienists are unhappy or are feeling kind of bogged down and are missing some of that passion. And from what you've taught me already today and educated me, I'm excited. I want to go back and share this information with my people and with my patients. So can you help us kind of excite the hygiene community with opportunities?
So in terms of the job market, what we saw over the last, I don't know, is it 3 years yet? It seems like forever during this pandemic.
Yeah.
So what we saw is those employers, we still have, think 92% working in a traditional clinical setting are dental hygienists. So the employers, the pandemic shone a magnifying glass on the workplace. So those dentists and employers that were doing a good job did a fabulous job during the pandemic. And those that were just doing an okay job or maybe not so great were horrific during the pandemic. And we heard from our members in terms of workplace. And you're right, Carrie, the job market, we saw dental hygienists leave the profession due to the pandemic and take early retirement, similar to other health professions. In our latest job market and employment survey, there was a potential for considerable turnover in the dental hygiene profession in the next 5 years. 10% of respondents plan to leave the profession within the next 2 years, and an additional 18% plan to leave within 3 to 5 years. And so that is like 28% of the profession leaving within 5 years, which tightens the job market, which means that the dental hygienist can actually have a better choice in terms of their workplace. But, you know, it's also important that dental hygienists know how to self-advocate. You know, dental hygienists are fantastic at advocating for others, advocating for their patients or clients, advocating in the community, but they're not necessarily as good advocating for themselves and what they deserve in terms of really good working conditions. And so I think it's really important that dental hygienists use research, like CDHA's job market employment survey, and learn how to speak for themselves. You need your own equipment and the reasons why. The reasons why you need paid sick time, where you need vacation, and give the data in terms of what are the national standards for that. In terms of negotiating, but also you have to be smart about it. You have to look at your job and look at it from a business perspective. For example, you can say, I have 95% retention rate for the client's patients coming into our practice, and I have brought in 10% new clients. I have my errors or nothing. You go through all the things that you've done in terms of enhancing the practice and building a business case, and then using the data to say, this is why I deserve this. And it's not always about money. You could say, I would rather have paid sick time or vacation or free parking or whatever it is that you value. And everyone is different in terms of what they value.
I think what you just brought up there with regards to, it's not always, we want to have a fair wage, and I'm not getting into the what do you get paid in which province and which city, but I think you brought up some other very valid points. Paid sick days, parking, or some other ways that they can incentivize you or make your life a little easier, extra vacation. Like, I would rather have another week off sometimes and make more. I'm like, okay, I'm okay where I am, but if I get that whole extra week where I can do with it what I want, or flexibility in that way. And I think, as you said, you've got to come to these meetings prepared. If you're looking for a raise, if you're looking for an opportunity, or you're interviewing the office, I feel like, when I go in to meet offices, sometimes I'm interviewing them as much as they're interviewing me. It's like, is this a good fit? Is this going to work for me long term? And, I think you've given some really valid advice. So I appreciate that, honestly.
Yeah, and I'll just share my screen just to kind of highlight the type of data that they can access in kind of, say, for example, our job market employment survey. So, for example, 86% of respondents receive at least one employment benefit. And the top 5 benefits are dental care, 61%, paid vacation, 53%, a uniform allowance, 42%, professional development, 29%, which I think is quite low. And 24% is parking. And so there's lots more details in the full report, but those are just kind of some examples of and then also you can look at hourly rates. So this is the current hourly rate in our 2021 survey, $46.32 average hourly rate. We do have breakdowns. I'm just giving through some of this. So we do have rates by province. So the wages do vary by province, and all that data is available in our job market and employment survey. And so I think this is the kind of data you need in terms of ensuring that your compensation is correct. And also you have to look at the benefits that you're receiving. And, you know, the whole package. It's not just about wages all the time. It's about the package, and you have to provide value too. We always, you know, the other thing you can ask for is, if you can ask for, say, pay my professional CDHA membership, and then I'll have access to all of the free webinars, access to continuing education, free access to a professional peer-reviewed journal, access to, we actually have a free legal line, so people can get, you know, workplace contracts information, talk to a lawyer for absolutely free. We actually have an employee assistance program, so they can get free counseling and lots of services that can help them. So why don't you ask your employer to pay that very small amount in return for all these benefits that the employer will actually benefit from? It's not just, and then they'll have the discount from RDHU, which is a CDHA membership benefit too. So there's so many reasons, and you can just, you know, advocate for yourself. And there is something in the chat regarding perhaps a union would help in this case. That, you know, maybe, but union dues are extremely expensive, and they usually only work in an environment where there's a large amount of employees. And so when you have 30,000 dental hygienists employed in thousands and thousands of dental practices and public health and long-term care, et cetera, workplaces, it's not really the environment. You should have a professional associations that's advocating for you. You should have, and looking to them to help you provide the resources so you can learn how to self-advocate as well.
Mm-hmm.
Well,
you brought up really good points.
Sorry.
Oh, it's okay. I was just saying, you know, I think that the first thing is asking. I think that that's a hard thing to do. I mean, maybe I'm just speaking for myself here, but just asking, like, my focus is always like, okay, well, I got to make sure that I get the hourly wage that I want to justify either leaving another practice, or, you know, is it enough?
Mm-hmm.
But sometimes that's not what's on the top of my mind. Is asking for things like CE allowance, asking for an allowance for, you know, uniforms. It's not all about that hourly wage, but just having that voice to ask. And what's the worst thing that they say? No, or they say that's preposterous, and then you realize that that's definitely not the office for you anyway, right?
Yeah, and I mean, it's something to consider too. You know, it's just, you might as well ask. There's no harm in asking, but you can't just ask. You have to be able to articulate the benefits of doing that, the benefits to your employer. Sure. So that's why I said, you know, like paying a membership due, you know, is very low cost in terms of all the benefits that their employee will benefit from. You know, and then they'll have access to opportunities like this and have discounts on all the great work that RDHU does as well. So.
And I really feel like more and more hygienists, we are very much, we want the information, we want to stay current, and keeping your CE up to date can really motivate and inspire you. It also can give you opportunities for different jobs or different things outside the op, or things that you can bring back to the practice and say, hey, you know what, I'm going to do this. I want to implement this into the practice. And if this is successful, which I know it will be, because we're very successful people, you know, I would like this in return. I think that I can show and I can help you grow your practice. So if you're stuck in a rut and you're not happy, definitely look for some CE opportunities that will help bring that excitement, and then you can bring that information back to your practice and you can show your value, because there's so much value in being a dental hygienist. I know, Anna Louise, you and I feel the same, and well, everybody here feels the same, but I know you and I were talking about that earlier when we started, you know, figuring out some of these questions about job market and CE and everything else that way.
Yeah, we have an opportunity to decide what our focus is going to be, things that we like to do, things that we do well. And we should continue to grow in those areas, because that just makes us more valuable to our practice, whatever type of practice you're in. And as you layer on other learning opportunities, it really starts to show, like, well, you could hand in, this is the CE you've done for the past 2 years. It becomes not necessary, because you end up exuding all the information that you've learned and you put it into practice, and the clients and the people where you go and speak about what you are all about as far as your practice goes will know that. So that all said, maybe Ondina, can you give us a look at what the working conditions are out there? Do they change between provinces? Are there some specific problem areas that we should know about our colleagues that maybe need more support?
That's a great question. And actually, this isn't even released yet. And I just got a copy about 5 minutes before this PowerPoint, but we've been working with the Healthy Professional Worker Partnership, researchers who had conducted some research examining the mental health issues, leaves of the absence, and return to work experience as a dental hygienist from a comparative perspective with other health professions. So I can just give some, you have to look at the realities too. Dental hygienists were significantly less likely to consider taking a leave of absence compared to nursing, midwifery, medicine, dentistry. And the reason cited for that is financial reasons, like I can't afford to take a leave of absence. This is mental health, and we all know the toll. At the very beginning, this pandemic, except for the first 3 months, when 90% of dental hygienists in Canada were out of work during COVID, and they were all calling us. But after that, dental hygienists were back on the front lines, working throughout the pandemic, in full PPE, very, very hot conditions, very challenging conditions, especially in Ontario with different IPAC protocols between dentistry and dental hygiene. It was a very, very challenging time for dental hygienists, and they worked through it. They continued to provide the oral health care for their clients and patients. I mean, it has taken a toll, mental health toll. I mean, a lot of times what we're hearing is they were given more time to see each client / patient, but then they've kind of cut that back, in terms of giving more time. And so it is seeing a mental health impact in this report. In terms of dental hygienists and dentists' intention to quit the organizational practice, 31% of dental hygienists indicated they were looking at it, and 18% of dentists in terms of that question. And so there is a huge toll in terms of their mental health, and that's why having a program like CDHA has with free counseling is really important. Like, you need to have the supports that, to support you. If you need to talk to somebody or read a resource, you need to take time for yourself to ensure that you don't burn out. You have to take care of yourself. Your health is the most important thing, because if you're not healthy, you can't care for your family and your loved ones, and also your colleagues, and also your patients and clients. So that's really, really important. So in terms of the impact of the pandemic on dental hygienists, mental health of dental hygienists is down, and their distress and burnout is significantly up. And so you just have to watch that burnout. I think people were, first of all, very happy to go back to work at the beginning, not happy about all the PPE, but very happy. But there's a huge fatigue that's happening now. There's a lot of fatigue and burnout. And that's why it's important to have conversations like this, to share people's challenges and share how it is difficult, and everyone's going through this and experiencing the kind of the burnout and the fatigue, not just in, you hear about it for nurses and doctors in our healthcare system, but, dental hygienists have been on the front line throughout this pandemic. And a lot of them, did vaccines, and they did screening clinics, and they were on the front line. And we actually worked very hard, CDHA worked very hard to get dental hygienists deemed as essential workers, and they weren't at first to be deemed essential, which we were successful at, so that they have priority access to vaccines. And that was really important to be on that federal list, so that when you got priority access to vaccines when they became available. So
what I'm
Yes.
having trouble with is understanding the lack of in-person care by family physicians. I don't get it. And I'm finding this very concerning, because I have elderly clients who have not been seen by a physician in 3 years, and their medications have not been reevaluated, their status has not been reevaluated, and they are being asked to have a phone call. Well, they can't even see them. And I find this very distressing. And then if they have a problem, then our advice has been, seek medical advice. Maybe that's to go to urgent care, but it's it's really challenging to us, who then sees them and realizes they're going, oh, everything's the same because I haven't seen anybody. It's
Yeah.
like, you know, I feel like I'm their primary caregiver, and trying to make sure that, you know, we're assessing everything we possibly can.
Yeah,
I'm
you're
really-
absolutely right, Anna. Like, that's so important what you just said, because, and that's one of the things we tell government. Dental hygienists are one of the few healthcare professionals people see when they're well.
Yeah.
Most of the other people go when they're sick, and dental hygienists have an obligation to refer to other health professionals if they see, you know, we did some training a number of years ago on elder abuse, because 60 to 80% of family violence and abuse is head and neck, and dental hygienists see patients every 6 to 9 months, and they can actually detect that and refer to appropriate sources. Dental hygienists have relationships with their patients, clients.
Mhm.
So they know them, and they tell when something's wrong. So having dental hygienists part of the interprofessional healthcare team is critical. And it's nice to see government starting to understand that. We've also been working very, very hard for at least the last 7 years with the Employment Skills Development Canada on a student loan forgiveness program. Right now, there's one for nurses and physicians. So if they go and commit to working in a rural and remote community for 4 years, then they'll get some loans forgiven on their student debt. And so finally, the government has said they're going to expand it. They've agreed to expand it. We've been having meetings with ESDC. We want to ensure that dental hygienists are included in that. So that'll really help getting dental hygienists in the community. Because as you said, dental hygienists sometimes are the only ones in those communities, and they're the only healthcare provider they see. And so it's really critical that we ensure that we have as many opportunities that we can. And CDHA tries to lobby and advocate to support that.
And I find right now when I'm seeing my clients, you know, that first part of the appointment, and everybody that watches knows that I'm on my soapbox about assessment and everything else that way. But, you know, we've got to take the time and talk about what medications they're on. We've got to take the time and do their blood pressure. We've got to take time and have that conversation, because I've said to patients, like, you haven't seen your doctor in 3 years. You need to monitor these things. You need to be proactive. I'm asking you to go and ask for an in-person visit, because looking at someone on a computer screen from here to here, they may look great, but the mental health and all those other things can show in their body language, can show in their walk, can show in many other ways that people need to see them. So I'll get off my soapbox, but I think you're right. And we also need to look after ourselves with our mental health. Does CDHA, can you remind me of the programs that you have that can help with dental hygienists if they're finding it a challenge and they don't have anywhere else to reach out to? Like, I know you guys have those resources, and I don't want to mess up in what I say, but can you please just reiterate that to all of our viewers?
Sure. We have, I'll share my screen so that you can see this one. So we have this Homewood Health, which is the counseling services. So through a member, family, and this is available to your family as well. So you can have counseling services in a number of areas, including workplace stress and family issues. There's also online resources that are available. So it's there's LifeSmart coaching, counseling face-to-face, over the phone, video, or online. So these are really valuable resources that members can use. That's the member and family assistance program through Homewood Health. We also have our employment legal line that I talked about. We have lots of free webinars that are available every year. We actually, at our annual general meeting, which is October 22nd, we have the session on guided biofilm therapy. So that's, you know, and that's free for all CDHA members as well. We also have free job boards, so employers can post their jobs, and we have huge a number of employers that actually post jobs. So, and actually the job postings have gone up significantly. So we know that there are job openings.
I also see there are perks for shopping.
Yeah, there's perks
for shopping. I'm not going to lie. I have that app on my phone here. When I go and get my scrubs, when I go and get my stuff, it's all from there.
Well, I mean, those are not the key reasons for joining, but it's additional, that's why they're additional kind of perks. But we also have been working on this healthy workplace online community, because having a healthy, respectful workplace is really important. And so there's a number of resources on that website. And we have been collaborating with the Canadian Dental Association and the Canadian Dental Assistants Association on this specific initiative, and trying to collaborate on resources and educate dentists on what it means to have a healthy, respectful workplace.
I think that part is so important too, just having the healthy, like, I mean, going back to what you were talking about, being the frontline workers and just reviewing that kind of mental health. Not only was it just so physically demanding, but because dental hygienists were working before a lot of other people were, they were often the first human that another person, another client or patient was seeing. So not intentionally, but all of the issues, all of the, you know, pressures and the sadness that they were feeling was kind of being then dumped on the dental hygienist. And we love our patients and we love being able to kind of come alongside them in whatever they're going through, but that's a lot, right? Yeah. That was a lot. So the mental health thing was massive during that time. So just the fact that you're pointing out the counseling available, I mean, maybe there's some of us who are still kind of recuperating from just this massive dump of pain and sorrow that was going on during that time. And then healthy workplace is so important because we need to be strong as a team to be able to kind of sort through all of these issues that are still going on.
Yeah, and it's also, there was a lot of social isolation, as we know, during the pandemic. And so you're absolutely right. When I heard from dental hygienists, the patients would just talk. They had to get, their appointments were lasting for hours because the patients were so lonely, you know, they had to talk to them. So it was very challenging.
Yes, for many reasons, right? It wasn't all sorrow and pain. It was just, you know, like I had a coffee the other day and it was really good and I have no one else to tell about this flavorful coffee. So it was a mixed bag of stories and feelings and emotions.
I think a lot of us felt isolated at work as well, because you would go into your room and you're with whomever and you have a, you know, let's say, you know, tops like 8-minute conversation, and then you're like delivering them out to the front and you don't talk to anybody all day, right? And no one says, how are you? You know, and I know that there's a lot of us that are, you know, still feeling, while it's getting a bit better, still feeling pretty isolated. I think that efforts made in team building and getting back to socializing together are well spent to reignite that team atmosphere and get everybody working together, because I think some of the tunnel vision that happened is still happening and it's all about their job, and you know, everybody's just trying to do survival mode, and unfortunately we're going to have to settle in here.
Yeah, you're absolutely right. And that's why, I mean, we do have our bi-weekly e-newsletters that go out, and we did do, you know, hundreds of COVID updates, and there still are COVID updates in there. There's going to be one in the next our e-news, because the government is still, we met during the pandemic with like at the first couple of months, probably daily with different departments, advocating for things like, you know, dental hygienists, if they're going to be out of work, are they going to, if they had mat leave, they won't have enough hours for EI. Like, so we had to negotiate all those types of things to make sure that governments could, I mean, dental hygienists could get the SUS program and get access to all those funding initiatives that the federal government had, which was great. But also it's ongoing, you know, in terms of, you know, access to vaccines. And then now there's still ongoing, you know, presence of Omicron. There's a new boosters that are being approved by Health Canada. And then the recommendations regarding that, and also the incidence of periodontitis and myocarditis, which again, you said you're doing those assessments. So sometimes it's the only, you know, healthcare professional. So that's why reading those updates and keeping up to date is so important, because you know, dental hygienists are one of the most important primary healthcare providers, in my opinion. Anyway, so.
Unfortunately, in my area, we're also experiencing a dry spell of N95s of certain types. And so that's sending us into a bit of a scramble too. So, you know, there are still lots of balls that we're trying to juggle, you know, as a, you know, ebb and flow of the pandemic.
the supply chain issue has been huge. You talk about the chips and the microchips for cars that you hear about. It takes a year to get a new car. Even in the electronic toothbrushes, they were way backed up in terms of microchips. A lot of the nose piece for the N95s, suppliers, like they were just waiting for one piece. So, and the costs have gone up significantly for, PPE, especially at the beginning, it was huge cost for all dental hygiene and dental practices. So there's been a lot to deal with, in the profession over the last couple of years, and you really need to be supportive. And so look at the resources that are available and then reach out, to get the support you need, or talk to some colleagues. But at least we are starting to get back in person. So, that's always a positive thing as well, to have that, in-person networking and opportunity to connect with your colleagues.
Any fun campaigns that we can be part of? I know there's always the purple one, put your purple on and everything else, but anything else just to bring us and unite us? Like I see when those pictures are posted, I'm like, oh my gosh, I want to get involved. Do you want to do this? Anything fun or interesting coming up soon with CDHA?
Well, we have our Monday morning motivations on Instagram. So those have been popular. So I encourage people to submit them into CDHA because we post them, from members. And I think we've heard it's just a small thing, but people, they really enjoy that. But we're just starting our plan for this fiscal year. We're really committed to working on diversity, equity, and inclusion. And actually having a lot of work in terms of National Day for Truth and Reconciliation and improving access for Indigenous peoples in Canada in terms of their access to oral health care. So our summit in Whitehorse is in a few weeks. We're very excited to finally be in person, and we're sold out. So we're very happy about that. And a huge focus of that will be on Indigenous peoples and improving access to oral health care.
Excellent.
Yeah.
Oh,
I was just going to say, when you're talking about the N95s, one of the companies that we are affiliated with is CanGuard. So if you're stuck for N95s, they have a special RDH page, like a tab. They have a whole bunch of different types of N95s. So I'm not sure which ones you're talking about, Anna Louise, but maybe you could check that. And that's
they're out there too, unfortunately for us, on that particular one. But
okay.
we're
the one that you've been fitted for.
Yeah.
So one of the things that we wanted to talk about, just to kind of share what's coming up, is we just finished the summer learn and save with the CDHA for the Dental Hygiene Quarterly. So for all the CDHA members, they were able to get a nice discount on that Dental Hygiene Quarterly. And that's something that we've been doing with the CDHA for how many years? Probably 16. It's been a long time. So for all the CDHA members, they get a 25% discount on the Dental Hygiene Quarterly, and that's like 3 hours of CE every quarter. And those are fabulous. We get a lot of really good positive feedback from people. And if ever there's a topic that you're interested in, always reach out to us, because we're open to, we have a lot of resources and very, we have so many people that we can reach out to present for us, to do research for us. So always feel free to reach out and just let us know a certain topic that you're interested in. Oh, there it is there. Yeah, so we still have the DVDs because there's some people that have been collecting right from the beginning, and some people still want that hard copy. So we have the DVDs, so you get 4 DVDs a year. Otherwise, it's online in your own personal portal, and you get 3 hours every quarter. Some of the things that are coming up in September, and like you say, it's nice to be back in person because we have a lot of virtual. Like everybody, we all pivoted during COVID, and then we've been able to maintain that virtual, which has been awesome for a lot of our members from coast to coast, because we have members from coast to coast. So this September, we have Influencing Oral and Systemic Health, a 4-stage approach, and that's with Lorraine Gambicore, and she started last night. But if ever you wanted to join in, because there are typically three nights, so it'd be 2 hours each night, you can always request the recording and then you can hop on and join the next one. We have this Saturday with Anna Louise Tolan, and that's on the implant management. And that is what time, Anna Louise?
That's from 12 until 3 Ontario time. So it allows
perfect.
those in the other provinces to,
Yes.
to also participate.
Yeah, so we're really trying to offer more live courses on Pacific time. So that would be 9 a.m. Because if we started at 9, it's 6 a.m. and it might be a little too early for a Saturday morning. So thank you for doing that, Anna Louise. And then Carrie, you have your What's New in Carrie's management, and that's coming up in September as well. Documentation for Ontario is next weekend, and that's online. But then you also have a national documentation, Anna Louise, and then your national AAP, or the new classifications. I guess they're not new anymore, but the classifications. And Carrie, you as well, you have something coming up. Then we have Danny Botbill, who's doing the virtual coaching with us for ultrasonics. For the hands-on, we have the myofunctional therapy practical program. And we're very excited about this program because we've just been approved as well through Saskatchewan Dental Hygienists Association and Manitoba. So we're very excited about that program. So you would take it online theory, and then you'd come to RDHU for a weekend. And we have had different dental hygienists and dentists come for that program. And we've got the Ortho 101, that's hands-on as well. We do have a theory only option, so you can do theory online, but then you'd come to RDHU for a hands-on if you wanted to participate in the full program. And then of course we have the Elevate Your Instrumentation Skills, which is always so much more with Anna Louise, right? I mean, people come, it's funny, it's one of those things that you don't know what you don't know until you come and then you learn, especially from Anna Louise. Everybody always leaves with, wow, I never thought that, or I never did it that way. And just, it's really great to learn other ways that you can increase your skills. So that is all on the RDHU website. And then we have Todd's coming up October 20th and 21st, Danny Botbill and Beth Rogersey. Is Beth Rogersey speaking there too, or no? Beth Parks is there.
Yeah, I'm not sure, but I'll be there. But
Beth
I'm
Parks
not
will
sure
be
about
there, and Danny Botbill. So that's in Kelowna, BC, October 20th and 21st. I'll be doing something with Dental Corp that day. And then Spectrum, which is in Toronto, and that is another live event. And I think we're all speaking there. Anna Louise, Carrie, myself.
Actually, I won't be there that.
You won't be there?
No, I'm going to be in Vegas.
Oh.
Oh, well.
Yeah.
That's a hard sell. I'm sorry. That's a really hard sell. Okay, Vegas, Toronto, but we are worth the drive to Toronto. If you're not from Toronto,
Absolutely.
totally fly in. Going to be an awesome. Well, it's a free event with Spectrum, so we'd be very happy to have you. Yes, we've got lots of stuff happening with RDHU. Lots of stuff are starting to happen. Check out CDHA. Try to attend their conferences. If you want that, monthly subscription, visit CDHA and sign up for the Dental Hygiene Quarterly. And next month we are launching this. We're trying again to do it every Friday, the first Friday of the month, except for if there are holidays. The next show is going to be on October the 7th with Dr. Jo Hall, and she's going to be talking about why we should be taping our mouths. So she's going to go over airway, a lot of cool stuff. So really well worth tuning in next week. Remember, these are recorded, so share them with your friends, your colleagues. Sign up and you'll get that email so you can watch it after. But we really appreciate your following us on social media, and also continually to come and try to motivate yourself and inspire the profession and the career to move it into the right direction. That's why we do what we do here. So thank you, everyone. Ondina, it's been a pleasure to have you. You have been a wealth of knowledge, a wealth of information, and I feel like with some of the comments, people have really been inspired by what you've said, and they have really enjoyed this session. So we really appreciate you taking the time to join us today.
Thank you.
Absolutely. And Ondina, there were a couple of, there was some conversation going on in the chat about some other topics too that we just didn't get a chance to get to. But if there were questions, like I know there was some chat about continuing education as far as like a bachelor's degree and other kind of topics that have been circulating in the chat, how can they get in touch with you if they have questions we didn't get to?
They can just email info@cdha.ca, and then that will get forwarded to me. So I'm happy to respond. I was looking at some of the questions, and absolutely right. There's a lot of really good comments that were made and really good feedback.
info@cdha.ca.
Information sharing.
Yes, and for the
Yeah. Yeah.
for the follow-up,
Yes.
so there's a lot of things as we're talking today. I'm taking some notes of extra links that I can send. So that won't go today. So that'll come out in a few days. So whoever's registered, whether you're watching us live or will watch the recording, you will get that follow-up email with the extra links, and which will really help with the layering of learning and just to guide you to different resources. So I would expect that in a few days, but I think today you should receive the follow-up just with the recording, and then you can get your certificate. All right.
Wonderful.
Okay. Well, happy Friday, everybody.
Yes.
So
Happy
much.
Friday.
That's fabulous. It was really nice to have you on. And yeah, so we'll be in touch with everyone, and enjoy your weekend.
Take
Bye,
care.
everybody.
Bye.
Thank you.